This is my student support system. Keep watching, keep learning.
Parental medications are given through a route other than the alimentary tract or GIT. This route, these routes specially denotes to the injections: intradermal, subcutaneous, intraspinal, intraarterial, intraarticular, intramuscular, or intravenous. The angle of the injection and the depth of penetration will indicate the type of injection. Giving an injection safely is considered to be a routine activity for nurses. However, it requires knowledge of anatomy and physiology, pharmacology, psychology, communication skills, and practical expertise. It is defined as putting a fluid into the body, usually with a syringe and a hollow needle, through the skin to a sufficient depth for the drug to be administered into the body. Understanding the syringes and needles. A syringe have three basic parts. This is the syringe which have three basic parts. The tip which connects to the needle. Then the barrel which is outside part and it contains measurement calibrations like 1 ml, 2 ml, 3 ml, 4 ml like this. And the plunger which fits into the barrel. So this is the plunger and has a rubber tip. Here there is rubber tip which also acts as a rubber seal. Most syringes are disposable nowadays and made up of plastic and individually packed for sterility. They are individually packed. Now the needle. Most needles are disposable, made up of stainless steel and are again individually packed for sterility, and sometimes they comes with the syringe. Nowadays mostly they come attached to the syringe. The needles have three basic parts. The hub which fits on the tip of the syringe. The cannula or shaft which is attached to the hub. It is hollow. There is a space in it through which the drug goes into the body. And the bevel which is a slanted part at tip of the shaft here. The gauge of the needle refer to the diameter of the shaft and we call it as G. The larger the gauge number, the smaller the diameter of the shaft. Normally 26G gauge needle is used for the intradermal injections. 25G to 24G needles are used for subcutaneous injections. 21G, 22G, 23G. These needles are used for intramuscular injections. And 18G to 21G needles are used for intravenous injections. Now we come to types of injection. There are many types of injections, mainly which generally you can use in the wards as well as in the OPD and dispensaries. These are intradermal injection. In this type of injection, drug is injected into the dermis under the epidermis. An example, you can take the BCG. During vaccination, BCG is given intradermally. Intramuscular. In this type of injection, drug is inserted into the muscle. Intravenous. In this type of injection, the drug is inserted into the veins. Subcutaneous. In this type of injection, drug is injected into the subcutaneous tissue under dermis. Intraspinal and intrathecal. In this type of injection, drug is inserted into the spinal cavity. And intraarterial, in this type of injection, drug is inserted into the arteries.
My student support system. Keep watching, keep learning.